Hello everyone, how you all doing? Welcome back to my channel. It is a girl Malizu Joya Dako. I hope you guys are having a beautiful day and also an amazing day. Please, if you're new, do not forget to subscribe, like, comment, and share. So on today's video, we're going to be doing something different, right? But before I come to that, to my returning subscribers, I'm always grateful. Thank you for always coming back. I'm super grateful, right? On today's video, I have a guest. His name is Dr. Frederick Unigbohai. Pardon me if I pronounce that correctly. Dr. Frederick Unigbohai, right? So, welcome, Dr. Frederick. How are you doing today?
I'm good. Thank you for having me here.
You're looking handsome, by the way.
Want me to blush on your program? Thank you. You're looking good. Looking good.
Thank you. And what's with the face cap, if I may ask?
Well, I think it's a brand for now. I've been on this face cap for over a year now.
Because I've been seeing it in your previous videos. I'm like, okay, because actually, yeah, I kind of talk to you on social media, right? But
Oh, really? With the face cap on?
yep,
Uh,
on your TikTok.
oh, that's nice. Yeah, so it's a brand. Maybe sometime later I might change and stop using the face cap. Yeah, but for now it's a brand.
Okay,
Yes,
that's
yes.
cool.
Mm.
So, guys, as I stated earlier, we're going to be talking about drugs and supplements. We all know that drugs and supplements, some people actually don't know what supplements means or what it entails. And some people think that drug and supplement are the same. And this is where the doctor is going to come in. But before I'm going to go into that, as I stated earlier, is a licensed medical practitioner who has a 7 years experience. And he also works with AIM Group. Yes, welcome once more.
Thank
So
you.
please, can you tell me the difference between drug and supplements so that people can always know the difference and try and elaborate because people tend to like supplement and drugs are all the same thing. So can you try and just shed more light about it?
Okay, I'll try my best.
Okay.
Let's start with drugs, first of all. Drugs. Huh? Drugs are chemical substances, number one. Drugs are medicines, number two.
Okay.
So I'm trying to define to make it easy for us to understand. Now, drugs are any substance you take into your body that creates an effect. Most times, a positive effect. Let's use the word positive. So we use drug, when we say drugs, we're talking about medicines. These are substances, chemical substances, and when you take them, they carry out physiological changes, reactions in your body to help you. Now, supplements are also medicines, meaning supplements are drugs. So, whatever you take into your system, you're taking it to look good, you are taking it for vitality or whatever, you are also taking drugs. Full stop. Now, there are different types of drugs.
Okay.
We have tablets, we have injectables, the injection, we have creams that are also drugs. Who will tell you I have skin rash? We take this cream to apply. It's a drug, it's a medicine. Now, most supplements come in tablet form. So when somebody says I'm taking supplement, but I'm not taking medicine, you're taking medicine. As long as you're taking it to do something for you. And there's a saying that says the first medicine you ever take into your system is the food you eat. People don't even know that the food you eat could be a medicine for you because if you notice as Africans, we want to dwell more on vegetables, on herbs, on roots. So those things we eat, they carry out changes in our bodies too. And if you carry yourself back to history before the advent of tablet and the other form, medicine started with roots, vegetables. So in the olden days, our forefathers would go to the farm, go to the bush, they cut the bark of a tree, they boil it, people drink, and they feel better.
As an
So
herbal method,
yeah, that was how drugs started in the olden days.
how it came about.
Yes, yes.
Well,
The popular anti-malaria quinine was from the bark of a tree, and then they extracted it and then modified it, synthesized it, and that's what we are today. So anything you take into your system that will carry out an effect on your body is a medicine. There are different forms, like I mentioned before, tablets. Now, the truth about supplement is an area in medicine, in healthcare,
okay.
that has been abused. Yes.
Wow.
Everybody wants to sell supplements. Everybody wants to take supplements. But the
Yeah.
truth is that some people don't even need supplements.
Wow.
Yeah, honestly. And it looks as if we are not in support of supplement, but we are. Just that because of social media, no regulation. Everybody wants to go on the internet. Oh, I need this supplement. I need this supplement. And if you're not careful, like I mentioned before in the beginning, you take what you don't need. It can carry out a reaction in your body that you don't need and cause you problems. So supplements are. So let me define supplement, please. Supplements are substances you take to support your body when your body is lacking something.
Hmm.
Supplement is not the mainstay of management. It's not the mainstay of treatments.
Well, supplement, I think it also has to do with vitamin D
Okay. Now, if we
or
go
B12.
further, if we now go further, there are
Okay.
different types of supplements.
Okay.
There are herbal supplements. There are vitamins that are also supplements. There are okay, I mentioned herbs, right?
Yeah, you
That
did.
are also supplements. Your fruits can be extracted into the supplement form. And we have different types of vitamins.
Mm-hmm.
We have minerals that are supplements. Your iron, your calcium, your selenium, your manganese. These are all supplements, and your body needs them to function properly. Now,
Wow.
in certain cases, you might lack some of these micronutrients. You know, in biology, they told us that we have the six classes of food: protein, carbohydrate, fat, and the rest. We also have micronutrients like your iron. Now, when you get to a certain age in life, you might lack some of these nutrients. Your doctor might prescribe them for you that you need it. But what we are seeing right now is that people who don't lack any nutrients in the body
Mm-hmm.
are going after supplements. You understand?
Yeah.
Somebody is eating fruits. You're taking oranges, watermelon, pineapple, banana, or whatever, and you're getting all the vitamins you need. You are exposed to sunlight. You don't need vitamin D now. But because we have been sold, when you listen on radio, when you listen on TV, on the internet, vitamin D will do this for you, strong bones and things. So it looks as if I don't take this, I'm missing out something. But you might not be missing out on anything. Are we together? So
Yes.
this is why we tell people before you take supplements, try to be guided. Not every supplement is also safe. You could take supplements and overdose yourself and come down with complications of supplement as well. So there needs to be a balance with the use of supplements.
Mm.
Mm. So everybody just, and when you go to see your doctor as well and you tell your doctor I need supplement, doctor says you don't need supplement. You might want to get pissed
Okay.
and angry, like, doctor, why are you not giving me supplements? Because the doctor believes that you don't need it.
Okay.
But because we have been sold, we have watched the TV that this is good. Now pregnant women need supplements.
Mm.
Kids could need supplements. Elderly people could also need supplements.
Wow.
Women who are close to getting pregnant, who are hoping to get pregnant, could also need supplements. So at different stage in your life, you could need supplement. This is why you need
When it's
somebody.
essential.
Yes, you could need some. You will need somebody to guide you,
A
but
physician.
not just a physician, a pharmacist, but not just waking up and telling yourself, "Now I need vitamin D." And no, no, it doesn't work like that.
Mm.
Mm.
Okay, that's good. What do you know about product that has been tested by independent labs?
I don't know much because unless the one that there are so many products. Number one, so many products. When you say product, most times we try to be specific. If you say product, which of the products are you talking about? Are you talking about certain supplements? Now, these supplements are made by companies.
Okay.
They publish their data on the internet. So, if we want to talk about a particular supplement, then we need to go read about their um, publication, their findings to know about them.
Mm.
But generally, we know that, let's use example, folic acid.
Okay.
We know that folic acid is extremely important. A woman who is trying to get pregnant, a woman who is pregnant, somebody who has anemia, shortage of blood, we know that folic acid is very, very important for this set of individuals. People who have sickle cell anemia could also use folic acid. So, based on the supplements, we can talk about them. But talking about products of individual brands or companies, we might not be able to talk about them because we need to read their data and we are not representing any brand. You understand? We are neutral. So, in that regard, we could just talk about folic acid, this and that and that. Sure, you understand what
Yeah.
yeah, yeah. Talking about the brand means we have a brand in mind. And if you're going to have a brand in mind, that means you should carry out an independent study. And if you're going to carry out an independent study, who is carrying out the study? Is it the Pharmaceutical Society of Nigeria? Is it NAFDAC? So these are agencies that try to be very neutral. So whatever they publish for us in the internet or online, these are what we read to make our informed decision as well.
Wow, that's good. I like the way you tend to break it down for our viewers out there to understand it.
I hope I'm trying to make it
You
simple to
did, you
understand.
did. I'm
I'm,
an acknowledging it. I'm
it's
acknowledging
a
it
lie.
for
You're
you.
just acknowledging because you are interviewing me. I don't know if the
Come
person
on,
listening,
doc.
I know the person listening is understanding too.
Come on. I'm
Okay,
acknowledging it. That's why I'm
okay,
telling you that it's a good one
okay.
there.
Thank you.
So our viewers out there would definitely understand what you're trying to say.
Okay.
So what do you think or what do you understand? Like let's now dive into drugs, right? So what is drug addiction?
Oh, drug addiction. To make it simple, drug addiction is a state where you can no longer function without taking that drug. In your normal state, you shouldn't be on anything. You shouldn't be dependent on anything to function. But drug addiction means if you don't take this substance,
Mm-hmm.
you cannot be in quotes, normal states.
Okay.
For you to function, you need this substance. You are addicted to that substance. You are tied to the substance. Now, as simple as alcohol, there are people who can't function without taking alcohol,
Yes, that's true.
and they are
And
addicted.
drugs also.
And do you know alcohol is also a drug? Because it's a
Yeah, of
chemical
course.
based
It's
on
a
what we
chemical
substance
substance.
that when you take into your system, it alters your function. So alcohol is it's drug. I'm using alcohol because it's general. Everybody can understand. We will not get flagged online.
Mm.
So if you need to take alcohol for you to function, then you are addicted to alcohol. And there are different stages. It could be mild, it could be moderate, it could be severe. I've heard of cases where someone, even when he's brushing, he has to take alcohol.
What?
I swear. I have seen.
A patient?
Well, not a, so most times people who take alcohol will tell you that they are not patient, they are fine. So this one never agreed that he needed help. But yes, saw him. A male, okay, a male. So let's not look as if we are trying to hide. A male. And he couldn't function without taking alcohol,
Wow.
despite all the advice. Yeah, that's addiction.
Oh.
Addiction. It can be bad. It can. So what are the consequences of addiction? Can affect your finances, number one.
Yeah.
Can affect your mental health, number two. It can affect your relationship, married or single. Work life can affect you at work. You can't perform at work. Do you understand? It can
Yeah.
affect your health, your physical health. It can affect your heart, can affect your reproductive system. You know, there are some people that are addicted to certain drugs
Yeah.
that affects their reproduction, can affect their hormones. So it cuts across every area of life. Yeah,
Hmm.
can be that bad.
Very, very, very bad and severe.
hmm Very bad. Can be very, very bad.
So, I'll come to the aspect of drugs again. Why do you think that why does generic drugs look different from brand drugs?
Generic.
Yeah.
Okay, from brand. Let's see if we can if I can break it down. So generic talks about the name of
Okay.
the drug. Example, paracetamol is a generic name. Paracetamol is a generic. So when you mention paracetamol, that's not even a generic name. The generic name is acetaminophen.
Acetaminophen.
Yeah, that is the generic name.
Meaning, what does
Good.
acetaminophen?
Acetaminophen is a medicine for pains, mild forms of pain.
Okay, like
Painkiller.
painkiller. Okay.
Acetaminophen is one type of painkiller.
Hmm. Like more
Paracetamol,
of pain relief.
good. Paracetamol is the most popular name for what do we call it now? Acetaminophen.
Okay.
Now that is a brand name in quotes. There's another brand name, Tylenol. So in medicine, most times we don't use brand name.
Mm.
So when you are prescribing for a patient,
Okay.
there in most cases we advise to use the generic name. So if I'm to give you ceftriaxone, an antibiotic now, I'm supposed to give you ceftriaxone. Then now there are different companies that make ceftriaxone.
Okay.
My company can produce ceftriaxone,
Mm-hmm.
Fred ceftriaxone,
Okay.
Joy ceftriaxone. When you go to the pharmacy, you will be given different options. You will see Fred ceftriaxone, Joy ceftriaxone. That is now brand, but the generic name is what? The ceftriaxone.
Okay.
You get the point.
Yes.
Now, why is it different? Because each brand, each company, in their make of their own medication,
Okay.
the way they make it can be different. So the way I produce my
It'll be
ceftriaxone
different from the way I
could be
produce
different
mine.
from yours. And people could also respond differently to different brands of that
Yes.
medication.
Mm-hmm.
It's not bad. Using brand name also goes with regulation so that you don't promote one brand and you leave the other one. So in medicine, most times we use the generic name when prescribing for patients.
Hmm.
Mm,
That's good.
yeah.
Thank you for breaking it down. Because right now,
Mm.
actually, earlier it was kind of confusing, but as you tend to
There's
break
okay.
it
There's
down
one popular
right
one.
now,
Sorry for cutting you.
okay,
Ampiclos. Everybody say Bicham. Have you heard of Bicham Ampiclos?
Bicham and pickles, maybe.
If
I'm
okay,
not
it's
sure.
whenever anybody mention Ampiclos, most time they mention Bicham. Bicham is one of the most popular brand for Ampiclos, but there are other brands out there for Ampiclos as well. So ladies abuse Bicham Ampiclos.
Yes,
Now you
that's
understand.
true.
Most ladies out there say,
But
I have.
mostly, sorry to cut you short. I think ampiclos is basically used to
Hmm,
for infection
you are
and
correct. It's an antibiotic.
yeah, it's an
It's an
antibiotics.
antibiotic. But our people abuse antibiotics
Like with anyhow,
anyhow without guidance.
without
Yes, and
instructions.
this is why we have problems. We have resistance, what we call microbial resistance, antibiotic resistance, meaning that you have now gotten to a point where these antibiotics no longer work for you. You take them, but they are no longer working because the microorganisms they have developed resistance. They have built a shield. These medications no longer work
At
at
all.
all on them, and it's a disaster.
And people are still
People are still abusing it.
without knowing the consequences.
Yes, without knowing the consequences. Yeah.
Must all ingredients be displayed on the label of a supplement? Must all ingredients must it be displayed on the label of a supplement?
On the label of a supplement.
Yeah. Like we're coming back to supplements now
Yes.
because I
Okay.
think you've given some
So,
emphasis
like from our
on drugs.
definition,
Okay.
like from our definition of drugs, medicine, and supplement. Supplement
Mm.
is a medicine, right? It's
Yes.
a medicine. So let's take it to medicine. Let's even leave it. Let's not talk about supplements. Generally, medications.
Okay.
All ingredients or all components of that medication
Mm-hmm.
needs to be detailed out. You understand?
Yeah.
If that is the case, meaning that every composition or every makeup in that supplement must be spelled out for you. But we find out that a lot of people are not even aware of what they are taking into their system. So
You take
whatever,
it for taking sake.
well, maybe because they are not enlightened, if people are not even aware.
Okay.
Number two, oversight. I beg you, it's not my business. Just give me, let me drink the medications and move ahead. But we've gotten to a level where we tell patients and everybody,
Mm-hmm.
whatever you take into your system, you should know. If your doctor asks you, what medications have you taken before coming to the hospital? I don't know. I just went to the hospital, that place. They gave me one white and yellow capsule like that. What is the name? I don't know. I beg. No.
Yes, that's
If
true.
I ask
People are
you,
fond of
if
that.
I ask you, what did you eat this morning? You know.
Of
I
course.
took egg and maybe plantain,
Mm-hmm.
whatever. You can tell me. Have you ever gone to a restaurant and they gave you something to eat and you just started eating without even knowing what it was?
It's not
You would
possible.
ask now,
Of
please,
course.
what am I eating?
Now, when it comes to our health
Health.
aspect, Nigerians are like that. They don't care.
Well, is it
Mostly
Nigerians? I think Africans,
Africans.
yeah, we
Oh,
don't care, and it's not right. So whatever you have in that medication needs
mm-hmm.
to be listed out. You need to know what is here and what is here. Is it safe for consumption as well? We also notice that there are some supplements. That is why we need to be careful with supplements. They are legit supplements. They are
Mm-hmm.
very good ones. But there are supplements that shouldn't be in the market or in the pharmacy. Because anybody will just wake up and name themselves one rubbish brand name, package supplement, and
Like
then
that,
they
the
start
marketing
selling.
it.
And everybody, because you hear, so when they want to market to you now, so when you drink supplements, you look very fresh, your brain will be sharp, and then you're like, and then they bring one young lady who's looking so fine, like, oh, this supplement, and then you buy
Without knowing
without
what.
knowing what you're taking. And who is vetting them? We have no idea. Why are you taking it? Because they did that. It's beyond advice. Don't take any supplement, don't take any medication because it's just been shown to you in adverts. Do your findings. Even if it's been spoken about by a medical doctor, still ask questions. Still ask.
Very essential.
Yeah, no, it's your life. You can't be careless with your life in this 21st century. Whatever you see on the internet, whatever you hear, even if I tell people when I make my videos, even if I tell you about this, still sit down and find out, okay, based on the information I have now,
Okay.
I think I need it. If you are not sure, speak with your doctor, speak with your pharmacist for more clarification. Don't just wake up because it's on the internet. Let me buy.
Yes, that's true. Some people are just fond of once because you know on internet we all have access. As soon as you have your data, you have your phone,
Yeah.
you just have to go there, search for what you're looking for, and whatever that pops up on the internet, you just buy it like that. You just
Yeah.
like, okay, I think it's right as
I
far as
think
on the
yes.
internet because basically it's someone that wrote that thing out there, right? And you
Yeah.
don't know if the person is actually a professional. Okay, so Doc, this is going to be the last question. And I'm going to ask you, do you think people should take supplements every day? Because you know you've elaborated in the aspect of the drugs, you've
Yeah.
given emphasis about that.
Yeah.
So just summarize it with, do you think people need to also take supplements every day?
Okay. My answer would be, why are you taking the supplements? That's the most important thing. Why and which supplement, and who is recommending the supplement for you? If you know why you are taking the supplement, then we've gotten to at least half of the answer. If you ask people, why are you taking vitamin C? Say, I just like it. You can't just be taking vitamin C because you like it.
It's supposed to be a reason.
There has to be a reason for taking vitamin C. If supplements, if you must take vitamin C, you can take your fruits. You have vitamin C in the fruits.
Of
But
course.
if you want to take the supplement, then there's a reason, and it's time bound. Now, even vitamin C, we tell you not to take it for too long because it can cause you kidney stones. It can increase your risk of coming down with kidney stones. So the answer is not a yes and no. It has to be a reason. Who is recommending this supplement for you? That is also very important. And what supplements are you taking? You can't just wake up and take whatever supplement you see out there. You need to be guided. You need to know why you are taking it, and you need to have a medical professional guiding you as well.
So, viewers, you've watched, you've listened to what Dr. Frederick has to say concerning drugs and supplements. He has emphasized and he has said a lot about it. So please do well to make good use of this information that is being shared on this channel because I tend to make sure that I want to be giving you good content so that you're giving me better. Click on that subscribe button. So before we go, Doctor, do you want to just say something to my viewers out there?
Well, what I want to say, okay, please subscribe. Yeah, look at the subscribe button down. Oh yeah, click on subscribe.
Just do well. If you won't feel anything at all. Just click that red button. That red button is very essential. Please just do well to click on it. And we've come to the end of today's video, guys. Do well to share, like, comment, and subscribe. But before we go, we want to say thank you to Dr.
Thank you for having me. Thank you very, very much. I'm grateful.
Thank you once more.
My pleasure.
So guys, we've come to the end of today's video. See you in my next video. Bye.